we were laughing, we're all going to head east because they're taking, you can get vaccinated now. We're like laughing. I mean, it's just, you try not to go there because there's only so much vaccine. So today was a record-breaking day, though, at the guard site. They did 1229 at the guard site.
Wow.
So we're pushing over 1,000 if we can, I mean, and it's like an iceberg. We're going to just keep chipping away at it, right? Every day, chip away at a few more, a few thousand more, we're trying to get through that. But it's not as fast as people want it. And for some other people, it's just not as slow as they want it.
Sandra, were chiropractors put in 1A?
Health, yes, they're considered healthcare workers.
My chiropractor didn't get notified or anything, so I was just wondering.
Well, it depends on when he registered, because you have to kind of think about this, and I'm going to teach you all this kind of little dance, right? So here's 1A, here's 1B, 1B plus. So we go like this, and then we have to keep going back, and then we keep going back. And we keep getting more, because there'll be people now that just register as 1A. Maybe that's, when you think about people that graduate from school, become a resident, become a dental hygienist, or a dental tech, they start, so we keep sweeping them back in. And maybe some people weren't sure at the time, and now they're sure, and okay, bring them back in. And the same thing with the 65 and older, so that I keep saying the number kind of grows sometimes in that center part. So we just have to keep going. And so we automate. We have a couple people whose job is to automate and bring in anyone who is eligible that doesn't have a vaccination in what we call position 1, right? So that we know to go and grab them. But none of these systems, in all honesty, they're building a lot of these things. We're flying them at the same time, but the volume that they have to do, when you think about what system really was ever set up to schedule 1,000+ appointments a day, and prioritize, and then you have breakdowns like we did for the Walgreens. We also looked at zip code then, right? So if 5,000 people want 1,000 appointments for just that site, how do you do it, right? And but the idea being that we're probably constantly kind of having to go back and sweep and do some more sweeping and do some more. It's like the garage floor that never gets really clean, right? I just have to keep moving it. And we do find, we say if for some reason, it's amazing we're not sure what some of the technology glitches are in people's registrations. Sometimes they add an extra period in there someplace, or, and you're like, how did that work? And Cheryl, where are you visiting today?
Myrtle Beach.
Oh, all right.
I've had enough of the snow.
I know. I saw that yesterday. That was cruel, between, daylight savings time kicking in and snow. It was just a little too much this week already. Yes. And Todd, we know where you're going.
Yeah.
Are we playing the Irish sweepstakes today?
Yes, we are.
I didn't know we had an office in Myrtle Beach.
Yes, I'm working remotely from there.
Awesome.
And you're all welcome to come anytime.
Give us the address.
Just Myrtle Beach.
Wow, that's too big.
Hey, Sandra, do you think there'll ever come a time when we'll have to have our proof of vaccination to go onto an airplane?
Oh, yes.
We took it out and had them laminated today out at the postal shop.
Yeah, and I think that there may be other events that would require to demonstrate.
My husband referees, and so he's going to carry a copy of it with him.
Yeah, no, I know, and that's been the most current after vaccine. Finding a second dose, which is if you don't go back to your same, it's like a game. The second one is if you lose your card, is another game, because we are technically not able to reissue them.
Wow.
That legal at the state and the feds are looking at that, because now I think that's going to be an unrealistic stance to keep for very long. But the challenge is validating 2 doses and then what type of vaccine you got, right? And lot numbers. So I always say when we're in those lines, don't take them out of your pant pocket now. Don't put them in the washing machine, be careful of laminator. So we had someone the laminator ate it. You know, but we
I
say,
scanned it and saved the scan.
Yeah. I've got it on my phone as well.
yeah. And I think that, time will change because I think probably, as we all know, I'll let Dr. Williams, boosters are probably going to be a thing as well. So I don't want anyone to think this is even a 2 and done.
Have we had any reports of people who have been vaccinated and then have now come down, contracted COVID?
Oh, and that sense of optimism, Todd Kisner would probably be the best because they do collect that information.
Okay. Well, thanks, Dr. Halverson, for that wishful thinking there.
No.
But there is IDPH has what they call vaccine breakthrough protocol. So it's really relying on our providers to identify if their patient has been vaccinated, and then after being fully vaccinated, then testing positive again for COVID. So there's a lot of legwork. Of course, they want us to go back to the initial specimen, which if the laboratory kept it, and by the time we get done with it, the person's probably recovered, but no reports yet. But when we do, I'm sure we'll have
We've
it.
come in between the first and second dose. We have had that.
Yes,
People that are
we've
not
had.
considered fully protected. And it's unclear whether they, were incubating at the time or again, but still more to come. Novel virus.
Well, the reason I ask is I have heard, but I have no proof, someone who was vaccinated early January and was just recently diagnosed. So I was just curious if we were keeping track of that or what had been heard.
Is that a St. Patty's Day fool joke or something?
No, this is legit.
Was it in the Rockford, Winnebago County area?
Yes.
Oh,
The next, all the people who become positive eventually get reported to the Board of Health. So, and then their vaccination status.
Right. We collected as part of the data.
right. So the question would be if they would pop up in Qualtrics, we'd have to run it against iCare to see, not Qualtrics, sorry, Salesforce.
Right.
Run it against iCare to
But
see.
it's a question right now in Salesforce. You have to answer it. Right. You have to ask an interview on the vaccination status and then retrieve it.
Right.
That's right.
So if someone did identify that they had been vaccinated, then we would verify the vaccination dates to see if they're outside that, if we'd consider them fully vaccinated after a second dose in 14 days later.
And you have to think about, not only do we have, no vaccine is 100%, right? We have cases of all kinds of vaccine preventable diseases in individuals who have been vaccinated. And the second part of this is the typing, right? The genotyping that's going on. And are we looking at a variant, right? We've had the first reports of variants in the state of Illinois. So again, we know that it's hard to do a comparison of all three vaccines head to head, but Pfizer were earlier in the phase when as much variants weren't running around versus the Janssen COVID-19 product, right? Which is, I'll be very precise, Janssen is the pharmaceutical arm of Johnson & Johnson. So people get confused a little bit, but it is the one that's been tested when the variants were more prevalent. So hard to say, but but that's why people still have to wear their face coverings. They still have to practice social distancing. And there's still risk involved. We're not completely out of the woods here yet.
All right, 6:35. So I guess we'll go ahead and get started. I don't see any guests, or do we have anyone for public participation? Excellent. We need approval of the agenda for March 16th, 2021.
So moved.
Second.
Excellent. Any discussion? All in favor, say aye.
Aye.
Approval of minutes from February 16th of 2021.
So moved.
Second.
Any discussion? Excellent. All who approve, say aye.
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 Excellent, excellent. Presentation.
I just thought maybe Dr. Williams, I'd like to introduce LaFakiri Yvonne, who is our new state's attorney. I know we didn't really get a chance at the last meeting. Maybe if you could all introduce yourselves. This is her first time joining all of us, I think.
Hi, everyone.
Hello.
Welcome.
Oh,
Welcome.
Well,
Did you
Welcome
want us
to
to
your
introduce ourselves?
Yeah.
Yeah.
Where do we start?
I will start. I'm Angie Gorel, and you can't see me. All you do is, you know, the other meetings we've been at. Why don't you go next, James Powers?
Okay, I'm Jim Powers. I've been on the board for probably 10 plus years on a variety of committees. Largely a career in the social service arena and mental health.
I'm Lucy Hoover, and I'm a representative at large. I'm a retired paralegal, and I don't know, I've probably been on the board for, 20 some years. How about it, Pat?
Yep, I'm Pat Lewis, and I've been on the board for more than 20 years with Lucy. I'm a nursing rep. I'm retired now, but was a nursing educator at University of Illinois.
I'm Dave Helland. I've been on the board for, I believe, 16 years. I was president about 10 years ago. The general idea is there should be a veterinarian on the board, and I am it. I used to own Alpine Veterinary Hospital. I sold to Veterinary Corporation. They instantly hired me as a consultant, and I'm having more fun.
I'm John Helverson. I've been on the board for 20 plus years. I am the dental representative, and I am not retired.
I'm Ron Gottschalk. I'm a member at large. I'm a retired lawyer from the General Counsel's Office, United States Department of Agriculture. That's why the shirt. I don't remember how long I've been on the board, so don't remember. And Angie, you don't see her picture because she's in witness protection.
You got that right.
I'm Dr. Alan Williams. I believe we met once on a Zoom meeting, but I'm glad to see you again, and you will enjoy your time with the board.
Maybe the rest of the team, I know we've all kind of sent her, Lafa, we've sent her things for us to review, but maybe if you could just go, I'll start with Todd Marshall, and maybe you can pass it off to the rest of the team members so she gets a visual on everybody, and tell a little bit what you do at the health department.
Okay, Todd Marshall, Director of Environmental Health. I think in the near future, we'll be getting together quite often. It seems like some concerns in the public and stuff like that from all different sorts. But I've been here for about 26 years, went from boots on the ground all the way through to leadership. So food program, wastewater, water, mosquitoes, housing, neighborhood code enforcement, the lead program. So multiple programs and basically deal with every sector of the county, the entire public. So it's going to be a welcome to the team, and we'll be talking soon. So thank you.
That's because he always runs into the law and has problems.
I'm the enforcement department. So yeah, state's attorney and us will
you're
get to know each other very well.
Maybe Mindy?
I'm Mindy Idell. I'm the director of the personal health services. So it's the clinical areas in the health department. The nurses all report to me. So we do lots of programs in the community where we visit pregnant women and women who have babies that are born with problems, breast and cervical cancer. And then of course the clinic where we do family planning and all of those things. And pretty much right now, all we're doing is vaccinating people.
Cheryl?
Hello, I'm Cheryl Floyd, and I'm Director of Health Promotion Wellness. And I think you may have worked with some of the staff. I have, what's her name? Jennifer Snapp with the tobacco prevention and drug overdose prevention, teen pregnancy prevention. And also we have our WIC program and the, excuse me, iGrow home visiting. We have a central point of intake for home visiting services for referring out to home visiting services. And I, like Todd, I've kind of worked, started literally in the basement over at Division Street in 1997 as a family case manager. And now I'm on the 4th floor over at North Court. As the, yeah, the penthouse. So, you know, on different wings of the penthouse over at North Court. So, well, look forward to working with you.
Cynthia?
I'm Cynthia Hall. I'm our Director of Strategic Initiatives, and during the pandemic, I've been leading our Joint Information Center to get some information out to the community about COVID.
She's also been handling the never-ending hotline and call center.
Yes.
Rebecca?
I'm Rebecca Lyons. I'm the Director of Public Health Emergency Preparedness. Right now, my main roles are with the vaccination planning and implementation of our vaccination plan for Winnebago County. And I've been here for, I think it's been 6 months.
She started during a pandemic. I can't, go figure. Todd Kisner.
I'm Todd Kistner. I am the Director of Health Protection, which encompasses all the communicable diseases, including COVID. So my team's responsible for the investigation of each and every communicable disease. We are the contact tracers, which are actually doing that reach out to individuals that have tested positive for COVID, doing those interviews, work within my center. And we also, within our center, have a program that works with folks living with HIV in our community, providing access to medication, medical services, and support services. So we're kind of busy at the moment. So,
Peter?
Hi, I'm Peter LePayton. I'm Director of Data and Quality. Unlike most of my colleagues, I'm a one-man band, and I work on COVID very closely with Todd and his team around the data and surveillance, and Rebecca. I also work on reaccreditation and the I-Plan. Nice to meet you.
Jim?
I'm Jim Keeler, the Director of Finance. I'm about 2 weeks away from completing my sophomore year here, and boy, what an education it's been. I deal with grant administration, budgeting, the financials, some procurement, and also human resources liaison, onboarding, offboarding, and a little bit of facilities, however I can help out.
He's kept us going throughout the pandemic, making sure all our bills are paid while we're all preoccupied. And Katie?
I'm Katie O'Toole. We've met before. I get to work with all the centers on their communication and messaging for the public and internally as well. And we also have worked together on FOIA. So.
And I'm going to put Christina's over there. She's commanding the ship over there.
I'm Christina Washington. I started with Dr. Martell back in May.
She keeps it all humming here. So we welcome you aboard and welcome you to our Board of Health meeting. So with that, I know, Peter, you've got the presentation floor.
Okay, thank you. I'm going to try and see if this will work to share. You see the slide deck? So I'm going to do the update that we do monthly. Starts on slide 9 of your package. Basically, we are up to 27,081 cases. We continue to be at a much lower rate of increase than we have been at. Our positivity rate has been pretty stable, and right now we're up to over 85,000 vaccinations. But this is the February update. CDC maintains a really nice website now that shows county by county throughout the country what the trends have been and sort of how everybody is performing. The only thing I'll call out on this slide is the fact that all those wiggly lines are all pointing downward for the most part. That's a good thing because that means our cases are going down, our positivity rates are going down, and things like that. The infection rate, we've tracked this over time. The only thing I'm going to call out on this slide, because you've seen this before, is in the lower right-hand corner, there's a little new box. The COVID Act Now website continues to sort of tweak and modify how they're sharing and presenting data. They've now added a vulnerability indicator, which is based off of a nonprofit organization called Sergo Ventures that pulls together and compiles data from the CDC, Bureau of Labor Statistics, Centers for Medicare and Medicaid, and a variety of other sources, creates indices for a variety of metrics, and then comes up with a rating scale. Winnebago County, they score as being at very high as far as risk, and the highest factor that does have to do with population density and various other socioeconomic factors here in Winnebago. I'm going to skip down. The only thing on the testing is I'm going to call out that the total number of tests on a weekly basis has started to decline. And we're now, whereas we had been ranging in the 10 to 12,000 tests a week, we're now running more in the 8 to 9,000 tests per week. Our case numbers have also been much lower, but looking at our cases over time, again, you've seen these indicators before. What I really wanted to just sort of point out is with both of these, what we see is the average number of cases, new cases that we were seeing every day, October, November, and through December is when our numbers went up so much higher. In November, we averaged almost 300 cases a day. By February, we were down to 41 cases per day as an average. And currently for the month of March, we're running at about 23 cases per day. So definitely through the second wave, we'd like to see those numbers, of course, continue to come down. Similarly, the positivity rate, you can see how it sort of peaked up through the fall and has dropped off, and it's now running, we're below, for February, we're at 3.3. Again, you've seen the slide before. The only thing I want to point out is when the whole state really went to phase 4, the line is tracking our positivity rate on a rolling 7-day average, and it has continued to drop. So with the loosening of the mitigations, so far so good. We see a continued downward trend on that. The next few slides, I'm really going to just sort of skip over those. These are our demographic slices in terms of by age, by gender, by race. These have been really pretty stable the last few months. We have not seen a lot of change in terms of the age distribution of cases. In terms of the age mix by month, we see little variations, but this has been pretty stable. Similarly, in terms of the race, ethnicity, we saw things look different very early on as the Latino and African-American communities, their numbers went up pretty quickly because so many of those folks are essential workers and were out in the community. The numbers now are starting to reflect more of what the distribution in Winnebago County looks like. And again, the Latino population has been hit hard in terms of their percentage of cases, and it's across really all age groups. Case rates, again, the Hispanic Latino community, even especially when we age adjust for the fact that it's a younger community, it's much higher. It's more than double what the overall case rate per 100,000 population is for Winnebago. Gender distribution has not changed. Women are disproportionately impacted at younger ages, and males over age 60 are disproportionately impacted. We look at hospitalization of COVID patients. The only thing we're really seeing here is just some slight reductions in length of stay, which is a good thing. We'll monitor that because that certainly has implications for capacity use of our medical providers. So if those lengths of stay have shifted so far very slightly, but if that continues, that's a positive thing. Another slide that sort of looks at the two waves of our cases. The communities of concern, there's nothing noteworthy to call out here. The top 5 seem to change a little bit every month, but by and large, this has really been pretty stable. No dramatic shifts over time. Those communities of concern continue to be target areas. Quick look at our school data. You can see that back in November, the number of cases by week were peaking. Schools went to remote and the numbers dropped. There was an increase in January. Those were college age students. That's the green peak. But since then, the case numbers have dropped for students just as they have for everybody else in the county. This is a new slide for the deck. Because now the state has the Winnebago data, has the county data and the vaccination data up. Again, this was sort of the snapshot at the beginning of the month. What it does show is our number of vaccines administered by day. That big tall line reflects really the software hookup of all of our Qualtrics data feeding cleanly into the eye care system. And now that data is incorporated on a daily basis so that we won't see that sort of a peak right now. But so we are at over almost to 86,000 cases with over 11% fully vaccinated. And I know the slide says 63% of the 65 or older population had at least a first shot. That was at the beginning of the month. We are now at 85% of the 65 and older population having at least one shot, and 29% is fully vaccinated at this time. The only thing about congregate settings I wanted to call out is early on, they were a significant portion of the cases. Right now, in December, we had over 40 locations with outbreaks, and there were over 500 cases in those long-term care or congregate facilities. As of now, there's only 5 locations still on the list with cases, and there's only 6 cases across those 5 locations. So we have not been adding new cases or new outbreaks in those congregate settings, which is really an incredibly positive thing. And that reflects the emphasis on getting those vaccines out into those facilities and the testing there. This has been really stable the last few months in terms of whether the deaths are in the community or in the facilities. In terms of causes of death and comorbidities, overall, this list has not changed. The associated causes, minimal changes month over month, and the workplace exposures have been stable. And as I started to say, this list of these 10 has been incredibly stable. A little bit of movement in between different categories, but for the most part, this is the list. And this again is on the county website. This is since we're reporting as of the end of February, Winnebago County was only tripping a warning on one indicator for being above 50 cases per 100,000. The nice thing is, if you were to look at it this week, which would reflect the most recent findings, we did finally drop to 46 cases per 100,000. And so we had no warning indicators at all for Winnebago County as of last week's update. And with that, I'm done. If there's any questions?
Excellent.
Thank you very much.
Thank you for your presentation. And it's good to hear that for the 65 and older, that we're at such a high percentage at 85%. That's very encouraging.
Yeah, it's one of those numbers that's been fun to watch.
President's report. I don't think I have anything. Committee reports, executive committee. I did not see anything. My favorite part of the meetings, finance. John.
So I will try and get through this quick because I'm getting notifications. I have an unstable internet connection. So give me one moment.
Dr. Halverson, if you have trouble, you can also take your camera off and sometimes it'll give you a little more bandwidth.
All right. Let me try that. And first order of business is approval of minutes from the March 10th, 2021 Finance Committee meeting. Do I have a motion?
So moved. Second.
Okay, any discussion? Not, all in favor of approving the minutes, signify by saying aye.
Aye.
Opposed, so passed. We will move into financial statements for February 2021. First is a resolution of expenditures incurred in the health fund in the amount of $786,919.31.
Move approval.
Thank you. Thank you. I have a motion and a second. Do we have any discussion? If none, all in favor of approving the expenditure from incurred in the health fund, signify by saying aye.
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 Opposed? So passed. We will move to page 28, which is our statement of fund balance from the beginning of fiscal year 2021 back in September to current end of February. Our net decrease, our total fund balance is $1,237,031.23. Our ending balance is still $9,496,369.20. Do we have any questions concerning this? None. We will move to page 29, the financial review. And this is the 5th month of Winnebago County's fiscal year 2021 and the 8th month of the state of Illinois fiscal year. You have our current year-to-date revenues, the budget, our actual and our variance, and our expenses, the budget, the actual and encumbered, and the variance. Do we have any questions concerning this? If none, we will move into the balance sheet, page 30. Again, we have our assets, liabilities, and fund balance for this period of the fiscal year. Do we have any questions concerning this? If none, we will move into our bank reconciliations. We have our 4 accounts. The general account, which can be found on page 31. As you can see, we received quite an influx of cash as compared to last month, February 28th. We have our lead account, which can be found on page 34. Again, that account received an influx as compared to the previous month. We have the abandoned properties, which can be found on page 37. Not quite as substantial, but we also received an influx. And we have our state of Illinois e-pay, which can be found on page 40. Again, we received a bit of it. That was our one decrease. Jim, do you have any comments about any of this? It seems pretty straightforward.
No, I think as we head to the just overall for the financial picture, get to the revenue and expense reports, we're showing a very sizable deficit at this point of almost $1,250,000, but next month we'll be recognizing our quarterly allotment from the real estate taxes. So that should erase about half of it. And I also know that we'll be discussing the food service permits, which are at-risk revenues have been on hold. So normally we would probably have those in the bank, by this time. So I think once we get some of these issues resolved, that we'll be heading more towards the break-even point for the whole year. If I were to, wipe the condensation off my crystal ball, I would say we would be heading in that direction. So that's just my overall comment or assessment. So
Thank you for that assessment. We will move into the revenue and expenditure reports, which can be found on page 43 through 45. Does anyone have any questions concerning those? We will move to page 46, which is our public health emergency reserve minimum graph. We are maintaining where we've been. We're actually a little bit higher, possibly the highest we have been since September 2020. No, I'm sorry. No, I was reading that incorrectly. We are.
Yeah, we're at about 8 million for
About 8 million.
2021, a little bit more than last year at this time. And I do have some reimbursement reports I just did for the contact tracing. And then we're expecting our population or our mass vaccination grant funds any day. I'm checking the comptroller's website every day for that. So I think, by no means are we bleeding cash. It's just kind of a ebb and flow at this point.
Thank you. We'll move into page 47, which is the accounts receivable, estimated accounts receivable through this time. You can see our October through February billings, where we're at with that. It looks like we are, as Jim said, expecting some of those funds to start to trickle in. We will bear with me one moment. Move into expenditure. Sorry, one moment.
We have the major expenditures start on page 48, Dr. Halverson.
Yes, I just have lost. Here we go. I apologize. Yes, we moved to major expenditures on page 48. We had 4 major expenditures brought to finance committee meeting. They were brought forward and it was committee voted and felt they should be brought to and agreed upon by the board. So
moved.
Second.
We have a motion and a second. Do we have any question or discussion concerning any of the 4 major expenditures? If none, all in favor signify by saying aye.
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 Opposed? So passed. We'll move into proposed contracts and agreement. We have 7, 6 of which we discussed in the financial committee meeting, A through F. Those were brought before committee and agreed upon to be brought before the board. Do I have a motion to approve those 6?
So moved.
Did I hear a second?
Second.
Thank you. A motion and a second to approve proposed contracts and agreements A through F. All in favor, signify by saying aye.
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 Opposed? So passed. We have one new agreement, which can be found on page 96 of the New Zion Baptist Church to be used as a National Guard vaccination mobile site for the amount of $1,600 a month through unspecified dates of March through September. And do I have a motion to approve?
So moved.
Second.
Thank you. Do we have any discussion or information concerning this, or additional information concerning this?
Sure, I can provide some background on this. We kind of gave a heads up to the finance committee that this would be coming through, but we were looking for what it's gonna almost sound like an oxymoron, a fixed mobile site on the west side of Rockford to vaccinate vulnerable populations, and working through the Rockford minister group, my minister's fellowship group. Cheryl always corrects me on this because there's several of them. They identified this site as a location that they felt would be a place to be able to provide vaccinations for the population, and they would be able to support it with volunteer staff as well. So we put it out there for 6 months. It will probably most likely operate 3 to 4 days per week. The goal is 1,000 vaccinations per week at that location as well, providing another alternative. And again, there will be other mobile sites involved, but this is also because we're going for a more, I'm going to say, more permanent site, as permanent as we're going to talk about here. But so we have it for a 6-month agreement to continue to provide vaccinations during that timeline.
Thank you. Any questions? No further questions or information. All in favor? All in favor of the proposed fixed mobile vaccination mobile site, signify by saying aye.
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 Opposed? So passed. We have one other point of business, a resolution to suspend the annual food and beverage permits. I don't believe I saw any information concerning this in the overall packet. This was brought before the Finance Committee last week. And the idea is to, because of the hardships financial hardships COVID-19 has definitely brought upon businesses, especially the dining industry. It is recommended that the food and beverage permits for Category 1 facilities be waived for this year. Those fees would be waived by the health department, but we would be reimbursed for those costs by the county board. Is that correct?
That's correct, Dr. Halverson. It's a request really to waive the fees for this fiscal year. The county board is going to look at their economic development through host fees, recognizing that this is a way for them to kind of, we have to recommend to them to amend the ordinance to waive the fee for this year for the Category 1 facilities, which are the highest risk categories. And those permits are due typically at the end of March. So you heard Jim talk about, we would have normally recognized revenue at the end of this year, but we were holding on that while working with the county to get this in effect.
I see Category 2 facilities.
No, it should have been corrected. It's Category 1 to start.
And those are the typical sit-down facilities, most of which are not the fast food facilities, which I believe you specified last time.
Correct. These are typically the highest risk facilities that typically have indoor seating and dining, which would have been most impacted. It's not the cook to order type facilities.
And this is not 1 and 2, it's just 1.
Just 1.
1 initially.
What is it?
May I ask how much will the county have to come up with to cover the cost?
Yes, I'll bring that right up. And they had already budgeted that out of the host fee, Angie, but they also may be looking at different sources of revenue, especially with the American Rescue Act.
Okay.
counties and municipalities will be able to offset some of these. But one of the first steps was to try and get this done before March so that our high-risk facilities, our Category 1 facilities are not having, let's be honest, we want to get that out there ahead of that so they're not having to pay and we have to reimburse them on this. So we'd like to be able to give them that relief as soon as possible. So we're asking the Board of Health to advance this to the Winnebago County Board for consideration.
Do I understand it right that you're saying this only covers Category 1?
Correct, right now.
So this is going to have to be amended.
It should have been.
Come
It
back.
shows Category 1 and 2.
Correct. It should be Category 1 only.
And then in the therefore section, it
I know.
mentions 1 and 2, but then in the second, be it further resolved, it says Category blank and 2.
It was, we corrected it, but it did not get out into the board packet. We corrected it as part of the motion coming out of Finance Committee.
True.
Do we have any other discussion concerning this? Okay. This was brought before Finance Committee. We did correct that to read as only Category 1, and it was recommended by committee to be brought before the board and agreed upon.
And
To the board.
to get back to you, the estimated dollar amount was $250,000.
Thank you.
Move that we recommend to the board, the county board, to approve this as amended.
Second.
We have a motion and a second. All in favor signify by saying aye.
Aye.
Opposed? So passed. And unless there is further business, that ends finance.
Well, thank you, John. I'm glad you didn't drop out on us. Policy, no meeting. Personnel, no meeting. Quality, no meeting. Any new business or other matters?
Angie, did you want to talk a little bit about the legislation?
I'm going to let you do this, please.
So Angie brought to it, and I'm going to bring this up. There's some proposed language that is coming up in terms of amendments to the Board of Health. And again, I'm going to give me a second here and I'll bring it up for all of you, but, and Lafa can also weigh in on this one as well, that there is some language being considered at this legislature through House Bill. I'm going to bring that up just a second here. That would prohibit county board members or elected officials from municipalities serving on the Board of Health. And I know that it's going to be considered by the Winnebago County Board. And we're trying to get a little more information on to who's proposing this or why they're considering the need to propose. But just to kind of give some background information, just from a health department standpoint, is that in some areas, the county board of commissioners may be actually the Board of Health for places, especially those that are resolution health departments versus referendum health departments that have a tax levy associated with them. And so not clear on where this is going or what's coming up, but wanted to make sure that that you are aware of it. And I'm going to bring it up right now. And I don't know, a lot of you have really quick here. I have too many screens open right now.
Unfortunately, I'm having technical issues, so I'm on my phone and my computer will not restart. So,
all right. So everyone give me it's House Bill 2804. And I will bring it up and give you a little read on it. And frankly, to be honest, it's not on anyone else's radar in terms of lobbyists and things. Essentially, it says, here's this, I'm going to give you the short version on it. Amends the Illinois Municipal, oh, no, sorry, that's not the right one. I got the wrong year. All right, give me a second here. I've still got, oh, that's interesting.
What it boils down to is that I could not be on your board, neither could your representative from the city of Rockford. After we are no longer hold a position on like the county board for 4 years, then we can be asked to be on the Board of Health. Otherwise, that would eliminate us. I have a problem with that. I think the Board of Health needs us as liaisons. Someone questioned me about, well, then all municipalities should have this right. And I says, no, because originally there was only one Board of Health. And those of you who have been around for a while know it was just, there was two Board of Health. There was one for the Winnebago County. There was one for the city of Rockford. And back in time, they decided, city of Rockford, to join us. And that's why we have a representative from the city of Rockford and I from the Winnebago County. None of the other small municipalities need to be part of this because they are covered under, they're covered under Winnebago County. So this is something that when I saw it, I thought, nah, I'm not happy with that. I do think we have to have representation.
Well, and I got it up on the screen. If you can see it, it basically amends the county's code, provides that no member of a county board or board of a county commissioners during the term of office for which he or she is elected may be appointed or serve as a member of the Board of Health of that county effective immediately. It's right now assigned to Ethics and Elections Committee, but again, kind of trying to keep a track on this and what would that mean or not mean, right, in terms of that. And it's not uncommon though for some county boards of commissioners, like Cook County, the Cook County Board of Commissioners served as the Board of Health, but then they also had a health board. I'm going to say the Health Facilities Board was kind of a subsequent on there. It does not appear that this has come from that region that you would think it might come from. So I think for those of you who don't always look on this, you can take a look and see who the sponsors are, where they come from. So it's coming out of Shelbyville. We've asked for the Illinois Public Health Association kind of lobbyists to give a call and see what was the rationale and how might we propose some amended language. Because I think it is important, to Angie's point, for those of you who remember the accreditation, where we brought out the actual referendum that put the health department and merged both the city and the county and talked about what the composition of the board was. I think that to Angie's point, that was the historical rationale. I also think to Angie's point, it does provide that liaison to our elected officials who, theoretically, they can take that policy for us. I mean, Angie serves to oftentimes when we're bringing things forward at the county board level, and our City of Rockford representative will also help us maneuver through things that we may be looking at. So just to kind of keep people in the loop about some of that's going on right now. But Angie had asked that we talk a little bit of, just to share, no decision making at this point, but just some information sharing. So it is House Bill, and again, I'm going to go back and see if my computer still works. Yes, it does. House Bill 2804. I get nervous when I get too many screens up and I go backwards, right? So, to kind of take a look at that.
The other thing, several years ago, when I first got on the board, the Winnebago County Forestry Department was run by, the president of that was one of our board members. And it so happened that the majority of the members of that board were on the county board. So anytime they wanted to do something, of course they passed it. They didn't, it was ridiculous. We were spending money that we didn't know where it was going because the board wanted it, and then they came to the county board and voted for it. So it eliminates that type of government. That's not good. Having a liaison is one thing, but running that committee and then bringing all that back to the board to be voted on so I can have my way and get the money I want are two different things and not fair to the taxpayer.
But
we got rid of that.
But given that Board of Health may want to consider this maybe at the next policy committee for a statement to go to the board, because it is on the board agenda. They don't have it as opposition or, support for. So again, kind of to be able to weigh in to the county board about thoughts on that or how we might propose an amendment from the Board of Health.
I think it's on the agenda for Thursday night for finance and operations. If it doesn't pass, then we don't have to worry about it. But if it passes, then yes, we do have to worry about it and we need to make a statement.
Well, they're just asking for a resolution regarding proposed amendments. So, but they don't have a resolution in support of or opposition to.
It should be opposition for this one. For House Bill 2804, the resolution is to oppose.
Okay.
Okay. Thank you.
I'm just looking at the agenda.
Okay. And then the other two bills, we have a support and oppose.
Okay.
And maybe, again, if I can bring 1721 is related to land bank. And again, this might be something that we want to, I'm going to bring it up. See if I can. And this is being proposed by our Senator Stevens, Stadelman. It basically amends the property tax code. A delinquent property value, the county may take steps necessary to acquire title of the property and may manage and operate the property, including but not limited to mowing of grass, removal of nuisance, removal of garbage, waste, debris, or other demolition or repair. It's almost like a fast track in some ways on that piece. So you may want to take a look at that as well. Senate Bill 1721. And the county will be looking at that as well. We'll try, in the future, we'll try and get this a little ahead of time so that you can see that before it gets onto an agenda for a committee already. But the committees are looking at that particular. So we can send that out as well, links to those bills, so you can take a little bit more time in that. All right. And then we have one more, which is, sorry. It is Senate Bill 2278. And again, the sponsor is Senator Stadelman from our region, amends the county's code. And this really relates to the new tax that was approved regarding mental health. Remember, the legislation was opened to include that the county could level up special county retailers occupation tax for public safety, public facilities, and mental health, substance abuse, or transportation. And remember, it was opened up to include mental health and substance abuse. And that was the tax referendum that passed in March of 2020. But it indicates may establish a 7-member board which shall oversee the use of funds received from the tax. And remember, this was part of, we had worked through the resolution process to establish the Community Mental Health Board that was responsible for oversight of the funds.
So is this proposing a change in all that?
Yes, it is. It's may establish a 7-member board. So, okay, I'm going to go here and see if this works. All right. So there's a very small section that changes, but it says any county authorized to levy a tax under this section may establish a 7-member board which shall oversee the use of funds received from the tax under this section. Such board shall be appointed by the chairman of the county board or chief executive officer of the county with the advice and consent of the county board. Members of the 7-member board shall be residents of the county who are over 18 years of age. The county board may by ordinance or resolution provide for the specific authority and procedures of the board.
So how many people are on the current board?
I have to go back. I'll have to do a little more checking on Give me a second here. I have to manage multiple screens.
If you remember, one of the things that,
Okay.
go ahead, Sandra.
You can keep talking about it. I got it up. Woo.
You got it?
So, and I can send this. I know Lafa was trying to find this as well. COVID computers here. This was October of 2019. Established, remember Section 3A authorized Winnebago to establish a 7-member community mental health board. So we got the number. And remember, our Winnebago County Health Department board member is Dick Coonard, but we should have him reporting to us on a regular basis, the activities of that. We serve as the fiscal agent for the board. And that was just for purpose of accepted donations of property and funds. And that was, so I think it really I think there may have been some questions about oversight of how did that fund, most of those taxes typically come into the local municipality for operation, but this became something on our radar that Angie asked me to share with everyone.
I've told you before that we have board members who want to control everything. And that's one reason when we put this together, and those of you who are on my committee, when we started with the health department looking to how we could get a mental health board together, one of the things I stated at that time, we did not want that, whatever monies we got, we did not want the county board to have any part of that money to balance their budget. It doesn't belong to them. It belongs to the taxpayers who voted for that half a cent tax. We've had this happen before, and we don't want myself, to be able to put our hands on that money. They cannot get it through their heads that because it is federal, it's state money, it has to come through Winnebago County, and that our auditor office, when that money comes, sets a number to that account. So we do the same thing with the Board of Health. Sandra, that money goes into Winnebago County. This is true, but it's put in a special account. And when we need that money to pay, we have to use those grants. We have to use the money before we can get the money back. And so what happens is we do an amendment, a budget amendment. That way we can bring it to the board, and we need this much money, and then they take it out of our account and give it to us to replenish our actual budget. And they can't get it through their heads. That is not their money to play with. That money is assigned to mental health, the mental health board, period. And it's been a real struggle every time this comes up, I have a real struggle arguing with our board members. So this has to be done this needs to be, I don't know, perhaps we should do a proposal telling, the mental health board should do a proposal telling them, keep your hands off. I don't know how that can be handled. But anyway, it's not their money. All we are as a county board is a pass-through. That's it. And that's the way it should be. And trying to get them to understand the Sheriff's Department does it, River Bluff does it, we do it, the Highway Department does it. It all is funneled through us because it's federal and state tax money. I'm done.
So there's lots of things that we have. I was going to say we have a very active legislation, legislators right now because they're back in session. And so just to kind of keep you abreast of what things are being considered at both the local and the state level. The policy committee may want to, as we get more information, may want to weigh in on those particular issues, and we can set up a meeting for the policy committee to review them and then decide if they want to take some degree of action on those.
And I want to thank all of you for being so supportive of this. Thank you, thank you.
Our pleasure. Any other business or correspondence? I have a quick question. How did the vaccinations at Ellis go as far as the sign up and how many people were vaccinated?
Yes, in terms of sign up, okay, I can give you the total number vaccinated. So just so everyone's clear, the Ellis Elementary School site was kind of a collaborative effort that we got kind of at the last minute with Walgreens providing 1,000 doses of Janssen COVID-19 vaccine and working with us to provide the scheduling. I'm going to say the scheduling. Walgreens requires them to complete all new paperwork. I will tell you that probably I'm glad people didn't have a fit when they got there because they had a lot more paperwork to complete. But overall, they did 950 at the end of the day. I would say that probably our system, was much more efficient in most regards. What we first did was we worked through the churches again, and they developed a code. I know Katie and Cheryl and the Communities of Concern group were out helping with registrations to help people get ready for this event as kind of a kickoff of the importance of registering for vaccination. I think there's a group that's kind of sat back a little bit, right? Not ready to commit. But that, as the saying goes, you need to buy a ticket to get on the train. So, you may decide you're not going to go on the same stops with the rest of the group, but you got to get going. And so we first pulled those individuals that were registered through that as part of that event. And then we started pulling the immediate zip code. So we offered appointments to over 2,000 to come in. And of course, they also had then, just to complicate matters so we already were technology challenged, they also had then go onto the Walgreens site. We had to present them the Walgreens scheduling system, and then they had to show up and do more paperwork. But after all that, we still had 950 people show up for vaccination. And the acceptance level in the community for the single dose was very high. And I also want to say that, there was a lot of the Rockford Public Schools did a big lift in terms of they basically opened up that school site, provided all the facilities and maintenance for it, as well as the volunteers. And so, one of the school nurses and I we were the observers. So we were in charge of making sure people didn't have reactions. And, but we found that people were very accepting of coming in and actually, how do I say, it was a sense of optimism. Many people, it was a very social event. How do I say that? People hadn't seen that many people around in a while. And so with masks on, 6 feet apart, sat in chairs and we're kind of back in, and we're trying to do this as part of getting the kids back in school as well, because we know that some families and intergenerational families are reluctant to send the children back because they themselves are vulnerable to return home. So I got to meet, as I said on the press conference, my first 100-plus-year-old person. I don't think I've ever met someone before, but I thought, wow, the sense of optimism and hope to come in and get vaccinated. And I learned that her birth date and I were only a day apart. So I said that was a good thing. But really I think you find it, if you can get it accessible to people and make it convenient. I was, overall very surprised, despite the fact of the paper and having to do 2 registrations and really how well it went over. Now, today was one of our banner days at the Guard site. I know I saw Rebecca. over 1,200 today. But we said we could do a throwdown. We can do it. We're going to do a little friendly competition. Jefferson High School on their second doses was close to over 11. I think they did 1137 for their second dose clinic. And that was using the school nurses, and our team is the vaccine manager. So we clearly can, when people, that's an essential work site, but we kind of say it would be kind of fun to have a little throwdown, a little friendly competition between locations. How can we get through? Because it was a long day with the Walgreens crowd. But again, they donated the vaccine. They had the pharmacist team in, and they brought all their other equipment in, but we were responsible for pretty much everything else around it. So big lift from Rockford Public Schools and our team to get people registered and scheduled, our communities of concern. And it created, I'm going to say a positive thing, a backlog of people that want to get vaccinated that we're trying to pull through now, either the Sandy Hollow site or as we stand up the West Side site as well.
Excellent. Excellent. Now,
Fantastic.
do we need an executive session?
We do not.
Excellent. Then if there's no further business, we need a motion for adjournment.
We adjourn.
Second.
All in favor?
Aye.
Aye.
It was great seeing you all. Be safe. Great job, Sandra, with the vaccinations and the whole staff and team. Have a good night.
See you everybody next month.
Thank you.